I'm going to introduce you to our Depression Center mental health clinician team. So this team brings knowledge and skills in several treatment modalities, such as dialectical behavioral therapy, cognitive behavioral therapy, mindfulness-based cognitive therapy, and compassion-focused therapy. So I will tell you a little bit about each one of them. They're going to present to us together. So Cristina Barrios is a bilingual registered social worker, and she has experience working in mental health and addiction settings with individuals from diverse cultural backgrounds. She's passionate about providing patient-centered care and empowering patients in developing skills to cope with their mental health concerns and stressors. Then we have Sarine Willis-O'Connor, and she's a registered psychotherapist who champions accessibility and equity in patient care. She's proficient in American Sign Language and has worked extensively with members of the deaf community and with individuals with disabilities. She has published and presented on psychotherapy research in Canadian and international publications and conferences, primarily on topics related to multicultural counseling. And we also have Hannah Albrechtsons, who's a registered occupational therapist who received her Master's of Occupational Therapy degree from the University of Toronto. Hannah is passionate about supporting patients who are experiencing mental illness to achieve their goals, to learn about coping skills, and to strengthen their resilience. So Cristina, Sarine, and Hannah will be sharing today on the topic of cultivating compassion. And so I will welcome them to share more with us.
Okay, thank you so much, Jenna, for introducing us, and welcome everyone to our presentation on cultivating compassion. And thank you for those intros. So for our presentation today, we are going to start with a mindfulness practice, and then we are going to introduce how compassion has been defined, research regarding its benefits, a little bit of information about the attributes of compassion, and then we're going to share a compassion exercise, ways to practice compassion, and leave time for questions. And we note that our talk today is meant to offer information and practices that we hope will be beneficial for you. And we welcome you to try the skills and follow along with the mindfulness practices that you feel may be helpful. But you absolutely don't need to try anything that doesn't feel comfortable for you. And we're just really looking forward to this time together. Okay. So to start off, I invite everyone to join me in a mindfulness practice, just settling into a position you feel like you can be in for the next 5 minutes or so comfortably. Maybe closing the eyes if that feels okay for you, or just gazing softly downward. And we'll just start by noticing our breath as we did earlier today with Jenna. Maybe just noticing where you best feel your breath in your body. Following each breath as it comes in and as it comes out. Settling into your own natural rhythm of breathing. And in a moment, I'll invite you to explore a practice called soothing touch, which can be a way to soothe or comfort yourself when feeling badly. And this might feel a little bit awkward at first, but research shows that our body really responds to physical gestures of warmth and care, and that this is something that can provide a sense of security and calm distressing emotions. And if at any time during this you feel uncomfortable, you're welcome just to come back to focusing on your breathing. To start, I invite you to just take one hand and hold the other. Maybe clasping the hands together or rubbing the hands together, massaging as you would if one of your hands was sore. And doing this with a sense of care, one hand for the other. Continuing with a soothing breathing rhythm as you do this. and just noticing how this feels. And now I invite you to take your two hands and place them on the belly. Feeling your belly rise and fall as you breathe in and breathe out deeply. And just noticing how it feels to connect your hands with your belly and with your breath. Maybe noticing a sense of groundedness and calm as you do this. And you're welcome to stay with this. Or I invite you to keep one hand on your belly and place the other hand on your heart. And being mindful of sensations in the body as you do this. And maybe nothing is happening or this just feels neutral. And that's completely okay. But just noticing if this does bring a sense of calm or soothing for yourself. And now placing two hands on the heart. And doing this with a sense of bringing even more support to yourself, bringing even more care to your heart. Continuing with a soothing rhythm of breathing and just resting with this for a few moments. And now if it feels okay for you, I invite you to stroke your arms or rub your arms either one at a time or at the same time. Again, just being mindful of any sensations or feelings or thoughts that come up as you do this. And doing this with a sense of warmth and care. And then if it feels okay, I invite you to give yourself a big hug. Crossing the arms one over the other, maybe swaying a little. Gently squeezing the shoulders or the arms, wherever you can reach. And if this feels okay, just staying with this for a moment. Being mindful of what you feel and connecting with the sense of comforting yourself. And now placing the hands back in your lap. And just taking a moment to tune in to how you feel after doing these actions. And if this practice was helpful for you, or if there were any gestures that felt particularly soothing or caring for you, remembering that they are something that you can do as a way of showing compassion to yourself as needed. And as we come to the end of this practice, also taking a moment to give yourself gratitude to being open to trying something new if this was new for you, and taking the time to nourish yourself. And then you can slowly open your eyes if they were closed, and maybe doing a stretch or whatever feels right to help you settle into our next moments together. Okay. So We often think of compassion as another word for being kind or nice to someone. And compassion has been defined by Paul Gilbert as a little bit more than that. And Paul Gilbert is a founding psychologist of compassion-focused therapy. And he defines compassion as having a sensitivity to suffering in self and others with a commitment to try to relieve and prevent it. So compassion is both awareness and action. First, noticing the suffering in ourselves, and then taking action, having motivation to care in courageous and wise ways with intention. A commitment to be helpful rather than harmful in order to alleviate suffering and to make life a little bit less difficult for ourselves and others. The reason that we're spending time talking about compassion today is due to its benefits for mental health. So research has shown that compassion-based interventions, such as learning skills to improve self-compassion, reduce self-criticism and negative thinking, reduce anxiety and emotional distress, depression, and have been linked with improved well-being, happiness, and life satisfaction. And improving compassion for self and others has also been found to have positive benefits on emotion regulation and interpersonal relationships. Lastly, research has been shown to have benefit for reducing caregiver burnout when caregivers are taught self-compassion strategies, and also to be beneficial for reducing unhelpful coping strategies that caregivers may use. And I'll now pass things over to Sarine.
Wonderful, thank you. So how do we become more compassionate? Well, it involves recognizing that we can experience compassion to ourselves, to others, and we can also receive it from others. So these are called the flows of compassion. So when we feel supported by others, we feel safe, and we're better able to extend that support to others and ourselves. By cultivating compassion in any of these flows, we're better able to receive it, practice it for ourselves, and extend it to others. When we're doing this, we're cultivating a compassionate mindset, or we're cultivating a compassionate self, which is that middle bubble in there. It's also important to keep a balance between the three flows of compassion. So sometimes we notice it's easier to be compassionate to others and really difficult to be compassionate to ourselves. And sometimes it's even difficult to receive compassion from others. It may feel challenging. So part of developing a compassionate self is noticing these blocks, or noticing how our compassion flows within these three flows. And so we can try to make space for all three flows of compassion to move more freely. We do have capacity to have compassion in all three areas. We don't have to conserve our energy by just giving it to others or just giving it to ourselves. We can do all three. Next slide, please. So it may feel overwhelming to think about being compassionate when we're going through depression or supporting someone who is going through depression, right? As you can see, someone who has depression, there are often so many negative thoughts about the self, thoughts about the world. We have really challenging emotions like sadness and guilt. And then we also have very painful and debilitating physical sensations like fatigue. And then we have behaviors that lead to social isolation and low productivity. And we learned about that, how loneliness can be so challenging. So how do we even begin to show compassion to ourselves when we're in the midst of this kind of depressive episode? And how do we show compassion to someone who is going through this? Next slide. So these are the attributes of compassion. These are the elements of compassion when we're able to be compassionate to other people or to ourselves, or receive it from someone else. So the first one is being sensitive. This is just the ability to become aware of suffering, pain, struggle, and difficulty, and being able to sit with it. So when we're having distressing experiences, oftentimes we want to shut it down, or we don't want to pay attention to that suffering. When we're engaging in compassion, we take that courageous step to pause and notice what's happening in our bodies, with our emotions, and with our behaviors. The next attribute is sympathy. So being emotionally moved by the experiences that we or others face, and wanting to help ourselves in those situations. So when we're feeling distressed, having that moment of, oh, wow, I'm feeling upset, or, oh, wow, that person is distressed. How can I help? And oftentimes we don't do that when we're feeling upset. We just want to move on, or we may want to shut it down. And then non-judgment is relating to one's and others' experiences in an accepting, non-judgmental way. So replacing judging, self-blame that may come along with difficult experiences, with a compassion awareness that seeks to understand these experiences. And then empathy, so making efforts to understand the suffering in ourselves and in others. So asking ourselves, what am I actually feeling? And how does it make sense that I'm feeling this way? So in what way does it make sense that I'm feeling really stressed right now? Or in what way does it make sense that I'm feeling really sad during this time? And then there's distress tolerance. And this is the willingness to engage with and tolerate discomfort as we work with difficult experiences. So when I'm feeling really upset, really anxious or really sad, what do I do to self-soothe? How can I keep myself safe and feel a little bit more comfortable while I'm feeling this pain in this moment? And finally, care for well-being. So this is the sincere motivation to help prevent or alleviate suffering and enhance well-being and happiness in ourselves and others. So this is approaching suffering with a specific intent. So we want to understand the suffering, why it's caused, why is it that I'm feeling so sad? Why am I feeling so stressed? And how can we engage in helpful activities to help alleviate or prevent it? So this is more of the long-term plan on how to manage our symptoms in a compassionate way. So this helps us manage our situation rather than being consumed by emotions or distress.
So how do we practice compassion? How do we put all of it into practice? And I want to just take a moment to give people some time to perhaps type in the chat how you practice compassion for yourself. Whether this is something that you do by maybe like the touching that Hannah guided us earlier on. If there's any other ways that come up for you when you think of that word, compassion, as how you practice it. So I'll give people a moment just to type this in the chat. What are some ways that you take care of yourself? See a couple examples coming in the chat. I love soothing touch. You can touch your hand without anyone knowing. Yeah. Respecting my boundaries. And I think that's a big one when we're a caregiver, when we have a loved one who's experiencing depression. It can be hard to set those boundaries, but that's a way to take care of ourselves. When I make an error, I remember that everyone makes errors. It's part of living and learning. So normalizing perhaps our experiences is part of that. Imagining how I would feel in the same situation as someone else to understand empathy. Yeah, I love that one. Activities that are comforting. Yeah. And recognizing that these activities that we do can be quite different for every one of us. Perhaps what I find comforting, it's totally different than what Sarine finds comforting or like anyone else. through walks outside and meditation. Yeah, those could be comforting activities as well. Taking courses to help my mental health. Yeah, I like that. Being here could be a way of practicing compassion for yourself and being in the space, connecting with others. It's very hard to do so. Yes, I'm glad someone is bringing that up because this is hard, which is why we were talking about it. It's something that it's hard to do. And at the same time, there's ways to cultivate that and make it more accessible. Someone sharing that it can be helpful to consider how you would feel toward a loved one in the same situation. Then you would find yourself probably are more harsh on yourself than on anyone else. Yeah, we tend to be quite critical and see ourselves in a different lens than what we see others. Noticing learning and red flags, staying away from them. Yeah, time for ourselves. Carving out time to do nothing, which I know it can be challenging to do in the midst of our busy worlds. And appreciating the time that we spend for ourselves. I love this one. We all deserve to allow ourselves to feel better. Yeah, there's hope around that. Meditation. Yeah, see a comment about self-compassion can feel very selfish. And this is a common thing that comes up for people as a barrier to connecting with compassion, especially if it's something that perhaps we're not used to practicing before. Maybe it wasn't modeled to us when we were growing up, that it can feel like a bit like, oh, I'm taking time for myself. What? Why? This doesn't seem like it's too natural. And it can feel like perhaps like guilt that we're doing this or selfish as someone is highlighting. Going out and having fun, yeah, in a safe way. Okay, so I'm gonna get into the specifics of like how can we practice compassion for ourselves. So part of that is to notice. We want to be able to notice that we are suffering in the moment without any judgment to it. And we can do this by using a caring tone, just how we would talk to a friend or to a loved one. We can use that tone to apply towards ourselves. And we want to do this by not judging ourselves, like really bringing some understanding like to the experiences that we have in the moment. So we can say things like, wow, I'm having a lot of negative thoughts right now. This is hard. I feel sad. Perhaps I'm noticing some tightness in my chest, and taking that time to like really recognize how we're feeling in the moment. And as someone perhaps that is experiencing depression, or a caregiver or loved one that is supporting someone that's living with depression, there can be a lot of criticism that can show up. Maybe we're not doing enough. I'm not supporting my family member the best way. I could be doing better, which can result in like feeling like pretty crappy. There's a result in feeling like quite difficult emotions. And it's helpful to notice these emotions when they come up. It's really helpful to be able to acknowledge like, hey, I'm frustrated right now. It's been quite a hard journey, as a way to start to put like compassion into practice. So once we've noticed, it brings like that awareness of like, okay, I noticed that I'm feeling really sad. I've noticed that I'm struggling. What can I do next? And part of relieving suffering in the moment, it can include bringing some understanding to our experiences and allowing ourselves to feel what we're feeling, which I know that at times it is easier said than done, because our emotions sometimes can be quite distressing and painful, or perhaps we're not used to feeling our emotions. Maybe when we grow up, it was, we were told that we were not allowed to cry, we were not allowed to feel how we're feeling. So perhaps it doesn't feel too normal to do that. But by allowing ourselves to welcome our feelings rather than resisting them and perhaps like pushing them down and down, and not allowing us to sit with those emotions, it can make us like feel those emotions like be more tolerable if we actually make space for them, and also less overwhelming, which can be quite helpful when feeling depressed. So when we are trying to relieve that suffering in the moment, we want to use a warm and caring tone again. When we talk to ourselves, we can say things like, you know what, it makes sense. I'm so frustrated right now because I'm worried others are judging me for making mistakes. And putting that like that added layer of understanding can really help to like soften that emotion and that experience, which then in turn will help to relieve it. We can also try to talk to ourselves as if we were talking in a third person. We can say, let's pause from sending that email. Let's take a deep breath, step outside, get some fresh air. And in the moment when perhaps we're triggered by something and something happens, we may have like this like knee-jerk reaction to do something right away. But taking that pause, taking that moment, asking ourselves, what do I need right now, can really help us to like better cope and tolerate when we're feeling distressed. We can also imagine what a mentor or a caring person in our life would say to me. Again, as somebody was highlighting in the chat, we tend to like be like quite critical in ourselves. So maybe like thinking about it, like what would somebody else say? How would they approach this situation? Can allow us to take some space from that distress. It can allow us to take some space from that pain. And we want to be able to ask ourselves, what can I do right now to allow me to calm myself, to make me feel better in a way that's going to be helpful rather than harmful, and doing it in a way that is wise and also caring. So we can relieve suffering in the moment. And then the other part is being active in preventing further suffering. So as a caregiver or a friend of someone that is experiencing depression, perhaps you may continually give out to others without attending to yourself. And that's quite normal. We tend to sometimes put other people first before prioritizing ourselves. But if we do this continuously, it can lead to burnout. And it's very natural to want to be there for our loved ones when they're struggling. It's very natural to put our needs second because we care about people. We want to be able to be there with them, and we care so much about them, and we see them that they're struggling. But at the same time, it's also important to recharge our batteries if we're a caregiver, if we're supporting a loved one, to then be able to have the emotional energy to be able to support our loved one. Because our battery slowly starts to wind down, we want to be able to nurture and recharge that. For someone that's feeling depressed, it can be really helpful to take like an active approach as a way to set like a caring plan, so that when a difficult day comes, we already have like a plan in place, and it's going to be easier to follow that plan. And that can serve as a buffer when those days come. Because when feeling like really, really depressed, it's hard to put all these plans into place. It's hard to take some action in the moment. But if we already have like a plan in place, it's going to be a little bit more easier. And as we're trying to be active in creating this plan of how to take care of ourselves, of how to prevent suffering in the future, we also want to be really curious and non-judgmental as to why the suffering may have occurred. Like, why am I feeling like this right now? Is there something perhaps that is going on? And as Dr. Mansour was highlighting earlier, there's so many different layers that also contribute to perhaps like maintaining depression, and on the other hand, to help like decrease symptoms, whether that's nutrition, looking at our diet or what we're eating or we're not eating, also considering the benefits of physical activity on how it can have an effect on our mood. We can make a plan to connect with others. I know this has been like a huge one during the pandemic, where we have become quite isolated and disconnected. There's been a huge shift in terms of what we're used to doing on our day-to-days. Our social circles have just moved in different ways. And that has affected people in so many ways, especially in their mental health. And we have seen that at our clinic as well. So it's quite helpful to be able to have that sense of connection with others, whether it's in person, virtually, how we're doing it today, and finding ways to ask yourself, like, when I'm not feeling depressed, what are some things that I like to do? What nurtures me in those days that I feel better, the days that are not as crappy? What's different those days? And trying to make a caring plan to follow, so that when we have a hard day, we're able to connect with those things for ourselves. So we have a couple of resources here, which we'll be sharing with everyone after the presentation. I just want to highlight a couple of them, which are different books to read about compassion if it's something that is piquing your interest, including compassion as a parent. And a couple of these books also have like very like practical exercises to work through as a way to reflect on ways to engage with compassion. And these websites are also from leader researchers and practitioners in the field of compassion, which include videos about compassion. It includes audio guided practices to connect with compassion, writing exercises, as well as like a host of different information about compassion. So I would invite people to connect with them if you found this to like be something of interest for you. Okay, so I want to take a moment to share with you a more like practical way to connect with compassion through a practice. Before we get into the full practice, I want to give people a moment to think about their favorite food. So taking a moment, you can either keep your eyes open, but perhaps it will be easier or more vivid if you close your eyes. So take a moment to think of your favorite food. For me, it's pad thai. But just think about that food. What does it look like? Does it have any particular colors? Maybe some visual texture? Just think of this food, trying to bring it to mind as vividly as possible. And as you think of this food, taking a moment to start to notice within you if there's perhaps any thoughts that are coming up for you. Maybe there's memories that are attached to eating this delicious food. Maybe there's some feelings that are coming up regarding this food. Maybe when you eat this food, it makes you feel a certain way, and just thinking about it, it's bringing up something for you. Also noticing any body sensations for yourself. Maybe your stomach may start to make some sounds as you think about this food. Maybe your mouth starts to salivate as if you had the food right in front of you. Also mindful that it's lunchtime later, so maybe this has to do with it. Just taking a moment just to notice that for yourself. And ever so slowly, you can open your eyes if they were closed and let go of that image. Hopefully you'll get to eat it after our session today. But I just wanted to give you a little bit of a taste, maybe quite literal, of what imagery can do and how powerful imagery is. And there's a lot of research in terms of the benefits of imagery, where imagining something can elicit like a host of different experiences for us. So we can use imagery as a way to cultivate compassion towards ourselves when we need it, during those times where perhaps we're struggling or we need to connect with a different level of care for ourselves. So now I'll be guiding you through 7-minute or so practice of compassion. And this practice is going to include a part of imagery. So to get started, just taking a moment just to get comfortable where you are right now. Putting your feet flat on the floor. For this practice, you can keep your eyes open or lower your gaze. Or you can close your eyes, whatever's available for you today. And as Hannah had mentioned earlier, if at any point the practice feels like maybe challenging, feel free to disconnect from it and come back to your breathing as a way to ground yourself throughout the practice. This is the practice that's yours, and you're able to choose throughout the practice as to what makes sense for you today. And we'll start by bringing awareness to your breath. Noticing the in-breath as you inhale. And also noticing as you breathe out. Taking a moment just to settle in to your own natural rhythm of breathing. Noticing your mind slowing down, your body slowing down. And seeing what comes to mind when you think about there being a compassionate other that is totally focused on you. Someone that understands you and is committed to always be helpful and never harmful. Think about what you want, no matter how unrealistic you think it might be. This is your unique image for you. If nothing comes to mind immediately, or if the image perhaps is not very clear, that is totally okay. Just taking your time and see what comes up. If many images are coming up, that's also okay. See if you're able to settle on one as we go through the practice. What is it about this image that gives you the sense that they are completely committed to you and will always be helpful and never harmful. Do you have a sense of whether your image is a particular gender? Do you feel they are the same age, older, or younger than you? What sort of size or shape do you get the impression of? Do you have a sense if they are human, an animal, or perhaps another being? What are their facial expressions? Maybe smiling in a friendly way. And next, we can think about how they would communicate to you. What sort of friendly and caring voice tone would you like? Imagining hearing that voice. Remembering that it's not about having a clear picture of this image. The idea is to just have a general theme of compassion. So your ideal compassionate other, it's not distant, like someone who doesn't have a clue about the actual pain, fear, and at times of despair of being human. We can recognize that it has felt those at some point. Shifting into the qualities that you would like your image to have. Perhaps patience, tolerance, wisdom, friendliness, gentleness, openness, understanding, strength, determination, playfulness, humor, easy to be with, or any qualities that are coming up for you right now. And now we'll bring the three core qualities of compassion: wisdom, strength, and commitment. Imagine this image you are creating for yourself today has deep wisdom about the reality of how tricky it is to be human. They also have great courage and strength. And lastly, they are completely committed to you. And with this commitment goes great warmth and friendliness and any other caring emotion. Noticing what it's like when you imagine this image being fully committed to you with friendliness, warmth, and caring. taking a moment to take this image, its qualities, perhaps choosing one quality that's standing out for you today. And knowing that this image and these qualities will be available to you whenever you need to connect with compassion in a time of distress, suffering, or pain. Taking in these qualities and this image to extend compassion towards yourself as you go along your day today. And slowly letting that image fade away, starting to come back to the present moment, noticing how your body feels where you're sitting, noticing your feet, how they feel on the ground, starting to ever so slowly bring some movement to your body. Maybe wiggle your toes, move your shoulders, whatever's available to you right now, and opening your eyes and joining us back as well. So that's our presentation. We are very happy to take on any questions, comments that people may have about compassion.
Thanks, Cristina, and thanks, Hannah and Sarine as well. I know as we were doing that practice, the point that stood out to me is the just how tricky it is to be human, right? Is how that shows up over and over again. So yeah, I'm curious about the topic of compassion. It's something that I'm passionate about as well. But if folks are struggling with this idea of compassion, where would you recommend that they start? How do you start to connect with it?
I mean, I think what Cristina did with the imagery exercises, I think, are an excellent starting point. Just connect it, and I like how she did both the food imagery and then also this kind of deeper, compassionate other one, because it can be just something as simple as thinking about your favorite food or your favorite sport or your favorite activity, and see how that feels in your body. And I think just the being sensitive and noticing is a good starting point.
Something that I would add also, we've already briefly touched upon, is asking yourself, what would someone else do right now? What would they say to me? Can be a quite helpful way to be able to provide that support to ourselves in those moments.
Mm-hmm. And I would just add, checking in with if what I'm telling myself is what I would tell another person as well, because often our self-talk can be so harsh and we would never think of telling those things to a loved one, but thinking of what they would tell us and what we would tell someone we love as well is a good, really quick check-in.
Yeah, those are all really great suggestions. And even to take it a bit further, why is being kind to ourselves and compassionate to ourselves helpful? For folks that may be being why would I want to do this?
Well, with depression, we have this negative lens in how we see the world, right? And when we have this lens, it's hard to have hope. It's hard to engage in any positive activities. But when we're starting to be more kind to ourselves, we're less self-critical, and that's how we develop this new type of lens. It's like a new pair of glasses to see the world, and it's easier to see hope. It's easier to see different ways of navigating the world. So when we're kind to ourselves, we're trying to figure out different ways, different lenses in seeing the world.
And I'll add that part of it is going back to that definition of like noticing the suffering. And with that, by noticing, we're able to like normalize it, because like oftentimes we hear from people who are experiencing depression that I shouldn't feel this way. Like there's like some blaming that comes along with like feeling depressed and not like getting better. And by being able to like notice how we're feeling in the moment and normalizing, like it makes sense that I'm feeling so stressed right now. It makes sense that during the pandemic, I have become isolated and I have felt like in different ways. It really changes like how we experience those emotions, and like we're like in it together. Like it really like brings that sense of like it's okay to feel like this.
Yeah, and I see a comment too from Dr. Abby, like just saying like this is a moment of suffering, right? So just acknowledging that, and I think like Cristina, you're summarizing that really well as well. And so it's not to, when we acknowledge this is a moment of suffering, we kind of maybe stop adding so much fuel to that fire.
Yeah.
And I have one other question that I'm curious about, like, if I notice that I'm burning out, like how do I be compassionate and set boundaries to care for myself? So, what would you suggest?
I know this is an overused example, but we think about in the airplane, you're supposed to put your oxygen mask first before putting the oxygen mask on someone else. And that's how it is with compassion and being kind to and self-care as well. As we have to take care of ourselves, and in order to be able to also take care of others. And as I mentioned in my part of the presentation with the flows of compassion, like if you're noticing you're only engaging in one flow, seeing if you can take a step back and redirect that flow and do some more things for yourself too. And when you do stuff for yourself, it doesn't mean that you aren't kind to other people, you aren't being compassionate to other people, you can't continue caregiving. It just means that you're doing it maybe slightly differently in a more sustainable way. So if you start having this self-criticism of I'm being selfish, I'm only taking care of myself, I'm not helping another person, seeing if you can just say to yourself, I'm helping that other person and I'm helping myself. I'm doing both, and that's okay.
Yeah, I like that, seeing kind of both sides to it, because they're both super important in terms of taking care of ourselves and caring for people around us. So yeah, thank you. I'm looking forward to weaving in some of what everyone's shared to my day. But with that, we're going to come to a close for today. So I'd like to thank everyone so much for joining us today. I know I've learned several new things, and I hope that you have as well.